Hi everyone, I want to talk to you about diabetes. Many people will be familiar with diabetes mellitus, but that is not the only type of diabetes we have. We'll talk more about that. And diabetes mellitus may not kill you if you are ready to fight it. So you need to cooperate with your caregiver and then work things out, and you can enjoy the rest of your life. What is diabetes mellitus? The other one is called diabetes insipidus. What is this all about? Well, they both produce large urine. That is common to both of them. However, there are a lot of disparities. Diabetes insipidus will produce large amount of diluted urine. Again, will produce a lot of diluted urine. That is diabetes insipidus. There are two forms of it. It could be central diabetes insipidus, which means there's a lack of antidiuretic hormone called vasopressin, and that is secondary to hypothalamic or pituitary dysfunction. And I said here that it means the problem is occurring upstairs, in other words, in the brain. It could be as a result of infection affecting the brain or secondary to trauma. The other type of diabetes insipidus is called nephrogenic diabetes insipidus. It occurs at the washroom downstairs. Don't mind my nomenclature, which means it's not a problem within the brain, but within the kidneys, because there is no adequate response to instructions from the brain. And it's as a result of lack of sufficient response to the produced antidiuretic hormone. Many people are taking a lot of medications. Lithium in particular is well known for this trouble. So lithium is associated with nephrogenic diabetes insipidus. Diabetes insipidus could be as a result of high test. You are testing, feeling thirsty more. Why? Because of malfunctioning hypothalamus, which will lead to high water intake. And when you take high water, then you need to excrete. And that will increase your urine production. And then it could be as a result of damage to the test mechanism in hypothalamus. There's gestational diabetes insipidus. I know you'll be wondering, all I've ever been told is gestational diabetes mellitus. There is gestational diabetes insipidus as well, and that could be treated with desmopressin. Diabetes insipidus is tasteless. The meaning of insipidus is tasteless. It's a Latin word. While the second type of diabetes is diabetes mellitus, and mellitus in Latin means sweet. So we have two types of diabetes, not two types of diabetes mellitus now. Two types of diabetes. One is diabetes mellitus, the other one is diabetes insipidus. Now, diabetes mellitus. Diabetes mellitus type 1. Number of people with acanthosis nigricans is minimal in type 1. The onset usually it will be acute, and it may even be the complication that will bring the patient for the first time, and that could be DKA, diabetic ketoacidosis, as the first reason to visit a doctor, on account of which the diagnosis could be made. Positive family history in 10% of patients with type 1, and is associated with autoimmune, HLA, DR3, and DR4. Sometimes we don't know the cause and we call it idiopathic. It's very common among whites, but no race is left out, so it is worldwide. Mostly pancreatic insufficiency with pancreatic antibodies in 80% destruction before you can start manifesting signs and symptoms of type 1 diabetes mellitus. Let me repeat. There is pancreatic insufficiency in them with pancreatic antibodies, and 80% of the pancreas must have been destroyed before the individual will start manifesting signs and symptoms of diabetes. There is low insulin and low C-peptides. The main treatment in type 1 is insulin. It could, in the olden days, they will always say type 1 is childhood onset. Yes, but with autoimmune, it's possible it could be diagnosed for the first time beyond childhood age. Diabetes mellitus type 2. Acanthosis nigricans is in almost 85% of the affected people. The onset is slowly over the years, but hyperosmolar hyperglycemic state or hyperosmolar non-ketotic coma could be the first sign. About 10% of patients with type 2 will have ketones. Positive family history in about 80% of them. So there is more inheritance linkage in type 2 than type 1. It is found in all races. However, blacks are more affected. Hispanics, natives depend on where you are. Natives in North America and US, Canada, but Asians are not left out, so it is worldwide. The problem here is not that there is no enough insulin, unlike type 1, but there is insulin resistance. So there will be high C-peptide and high insulin. Greater than 75% of them will likely be obese. So if you do your BMI, they're likely going to be obese. The age of presentation is variable. In the olden days, they would say, okay, type 2 is adult onset. No more, because it's even now found in teenagers. Still talking about diabetes mellitus, we've talked about type 1, type 2. There's what we call borderline or impaired diabetes mellitus. I'll talk more on that in a bit. Gestational diabetes mellitus, yes, that is what you're familiar with, right? The other time when I was talking about gestational diabetes insipidus, some people will say, no, I've never had that. Yes, you've had both now. So gestational diabetes mellitus, later on we'll address that. Drug-induced, we'll address that. That's what they call maturity onset diabetes of the young. In this case, they are less than 25 years. It is non-insulin dependent diabetes mellitus. Okay, and it is autosomal dominant in inheritance pattern. No autoantibodies. That is why they are different from type 1. They are still young people, but they're different from type 1. And MODY is about 5% of all diabetes mellitus. Drug-induced. Antipsychotics. First generation antipsychotics like phenothiazines, and also second generation like olanzapine, clozapine, quetiapine, risperidone, and paliperidone. If you have any patient on those medications, check the lipid, check the heart, check the glucose level. But ziprasidone and aripiprazole, they have low probability of causing diabetes mellitus. Thiazide will increase glucose level, so also are the vasopressors, epinephrine and norepinephrine, and of course, beta blockers like propranolol, metoprolol. Still talking about drug-induced diabetes mellitus, immunosuppressants, for example, cyclosporine, steroids of various forms, could be oral contraceptives, could be hormone replacement therapy, or even anti-inflammatory glucocorticoids could all shoot the glucose level up. Niacin for your lipid, and HIV patients are not left out. The highly active antiretroviral therapy could be the reason. Of course, gestational diabetes mellitus is as a result of pregnancy. We'll go in details later on that. And we call borderline or impaired diabetes mellitus. So in conclusion for now, we have just gone through the different types of diabetes insipidus and diabetes mellitus, and the different types of diabetes mellitus. We will have to discuss each of those in details. So there's more to talk about. Watch out for the next video on diabetes mellitus. Thank you for your time. And please remember to subscribe to my site so that you can get all these videos on time. I appreciate it.